We're going to talk now about factors that affect drugs that are administered orally as far as they're being absorbed and their bioavailability. So we've already talked about how a drug has to be lipophilic to penetrate the gastrointestinal mucosa, get into those cells, and then be absorbed into the systemic circulation. Part of that is they have to be small enough to dissolve in the membrane. So that might take some breaking down in the stomach in that acidic environment, but also drugs are formulated so they will dissolve down into a form that allows them to go across the membrane. A couple of things to know about that um, the gastrointestinal mucosa is that there are some special uh, protective mechanisms in them. So the first is P-glycoprotein, or it's abbreviated PGP, and these are active transport pumps that exist in these cells. And even though a drug may get into those mucosal cells, this active transport pump might recognize it and kick it out. Sounds kind of funny, but they use energy, right? And they pump um, the drug back across the membrane, across the concentration gradient. It's just a protective mechanism that we have. We usually talk about metabolism occurring in the liver, but there is some metabolic action in these cells by something called the cytochrome P450 um, metabolism system, and it's abbreviated CYP. And these exist in some of these gastrointestinal tissues, and they will metabolize the drug, sometimes making it more inactive, sometimes increasing its activity. But they tend to have a protective mechanism. So a drug may be affected by one or both of these systems as they move across and may be rendered ineffective if they're given orally. There are certain drugs that we can't give orally. There's one more way that drugs can be inactivated too as they're given orally, and we'll talk about that in a minute. So we need to have, if we're going to get drugs into the systemic circulation fast, we want them to dissolve. So they have to easily break apart or dissolve in the gastrointestinal system so they can get across those barriers, the gastrointestinal mucosa. Liquids readily get across. They tend to have a higher bioavailability simply because they are much more easily absorbed. So a liquid usually is a faster way to get a drug into the systemic circulation. Sometimes we don't want things to get in there super fast, so we have a sustained release type of formulation. These are drugs that are meant to slowly be released into the gastrointestinal system and absorbed slowly and last longer. We don't have a lot of those in veterinary medicine. We are typically using a human formulation, and that may or may not be a good thing depending on how fast the sustained release would break down. Another thing that we can use sometimes to get the drug to the right place is enteric coated tablets. And these enteric coatings allow a drug to pass through the stomach without being dissolved. They're intended to dissolve in the more alkaline environment of the small intestine where they are absorbed. So once a drug gets into the stomach, um, that will affect how quickly it is absorbed. And gastric motility, or the motility of the stomach, has something to do with that. So, as as I was saying, most drugs are absorbed in the small intestine. That's where they are intended to be absorbed. I did give you an example of aspirin, which is more acidic. And so it is more lipophilic and it will go across the stomach mucosa. But Otherwise, most drugs we're intending them to get to the small intestine to be absorbed. So if the stomach is moving quickly, if we have a lot of motility in the stomach, we don't have a lot in there and it's just moving things, passing things through quickly, we're going to get to the small intestine quickly. So that will affect how fast it gets there and is absorbed. This is one of those science exhibits where this kid is crawling through a model of a small intestine. Look at all those microvilli. It was too cool not to include that picture. On the other hand, if we have a traffic jam in the stomach, if we just have a lot of, the stomach is really still for one um, factor or another, um, a lot of food in there or something like that, where it's just, it's not reacting well, or we have a blockage of some sort, that's going to delay the onset of action of oral drugs because, as I said, most of them we're trying to get them into the small intestine. And so we needed to get through the stomach to get there. On the other hand, when we look at, so this is just saying the increase in gastric motility will allow the drug to get where it needs to go and be absorbed faster. So when we get to the intestines, it's going to be an opposite effect of the stomach activity. So in the intestines, if we have increased intestinal motility, we're talking about diarrhea usually. We're moving, the food is moving through and it's turning into feces and it is moving through fast and there is not enough time for a drug to be absorbed. So we need to bear that in mind if we're giving an oral drug to a patient that has diarrhea. On the other hand, if we have decreased intestinal motility, and it's the opposite of diarrhea, which is constipation, then we have the retention of the drug in the intestinal tract for a longer time. That's longer time for the drug to be absorbed. More will be absorbed, and we could potentially have a toxic situation. So we need to bear that in mind when we're giving drugs orally to an animal that has a gastrointestinal tract affected in one direction or another. Something else that happens in after the drug is absorbed is drugs. You can see all the blood vessels carrying um, through the venous system. So this is how the drug would be absorbed into the veins and be heading back toward the heart. And it would be going through the liver first. And this is before it really enters the general systemic circulation. We're just going from um, the intestinal tract in through that liver. And the liver has a function of trying to recognize toxins, trying to protect us. It's a detoxification kind of part of our body. And certain drugs it will recognize, similar to, you can see I've got the CYP and the PGP. I talked about those two. This is our active transport pump that will pump some drug molecules back out of those mucosal cells. This is the CYP that might metabolize the drug in a certain way, and then then it will be excreted. But if the drug gets through into the liver, it can go back be metabolized and go back via the gallbladder into the gastrointestinal system and be eliminated. So the liver is just rejecting it on its first pass through. So that's why it's called the first pass effect. Valium cannot be used orally very effectively in dogs. So we tend to use that as an injected drugs in dogs only. So some other things that we have talked about these, I'm just going to kind of go over them quickly. We're continuing to talk about drug absorption. When we're giving drugs parenterally, so injecting them either sub-Q or IM, they have to be hydrophilic to diffuse through the tissues and get to the capillaries. But also, we need to be careful about where we're placing the drug. It would be ideal to put it into a well-perfused tissue, such as muscle. So we typically want muscle that is used a lot by the animal, so the back or the legs. It's hard if you ever had a pain in your back. Every time you move, you feel that. So you're using your muscles all the time in the back. It's hard to move anywhere without using those muscles. So those are good ones to place. The epaxial muscles are good muscles to place drugs in. Also, the large muscles, semimembranosus, tendinosus of the legs as well. So subcutaneous tissues like fat. This is a big blob of fat. It's probably a lipoma, a fat tumor that was removed. This is predominantly white as opposed to muscle. You can see little vessels in it, but it's not well perfused. So we do not want to inject drugs into fat. They will just stay there for too long. They don't get where they need to go. So, and just we want to always inject into active muscles as opposed to inactive muscles. Bear in mind that if you inject something subcutaneously, the skin temperature will allow the drug to leave that area or not leave that area. So when we have cold temperatures and we're injecting animals subcutaneously that are living outside for the most part, large animals, that drug is not going to get into the system as fast because typically what happens is if an animal is truly getting cold, the body will shunt the blood away from the skin toward its core organs. So, and if we see a hypothermic animal, we need to warm them up before we're going to be able to give drugs subcutaneously in a very effective manner. So we don't want to be doing that. But depending on if in a warm environment, we have a lot of perfusion. That's usually blood moving there to try to cool the animal off, and we're going to get drugs into the circulation a lot faster. So vasoconstriction. So this is kind of what I was just talking about. With increased body temperature, we get vasodilation, opening of the blood vessels. We're going to get good drug absorption, vasoconstriction. We don't get that. We use that to our advantage when we give a local anesthetic. A local anesthetic, such as lidocaine, is mixed with epinephrine, and epinephrine is a drug that tends to cause vasoconstriction locally where it's placed. So what that does is it keeps the lidocaine there because it's constricting the blood vessels so that the lidocaine can't leave. The lidocaine stays there and exerts its local anesthetic effect. So I want you to think about factors that decrease drug absorption and factors that increase drug absorption. And you're going to need to answer questions about that.